to 11 a.m. every Saturday on KSJE.
Good morning, everyone. I'm Megan Cullop, along here with Scott Michlin.
Good morning. It is Thursday, January 14th, 2021.
It is.
Week 45.
40, yeah.
Right?
I think that's right.
It
Yep.
has to be week 45.
Yeah.
Maybe the calendar queen will chime in on
Yes.
Facebook and let us know
Yes.
what the right number is. But anyway, welcome, everybody. Good to see you.
Good to see you, as always.
Thank
now
you.
that we're only seeing each other once a week.
Once a week. It's just not enough.
It's not enough.
It's okay. That's all right. That's why I stalk you on Facebook. But it's
Yeah.
okay. It's okay. Happy anniversary, Megan Cullop. This is your 1-year anniversary with KSJE.
Yeah. Right, that's right.
How about that?
January 11th, yeah,
That
is
would
when
be
I started.
52 weeks.
I know.
How about that?
It's so cool. It's been a joy.
Well,
So,
thank you for saying that
yeah.
publicly.
Yeah.
I appreciate it.
Well,
So there you
I
go.
mean, I guess my annual review has gone well.
Yes, you're still here.
Yes,
Your
so-
key still works, so there you go. So
That's how you know. One day I'll come and I'll be like, they changed the locks.
That's right.
Yeah.
But no, we're all good. But folks may not know, of course, your other hat that you wear is Radio Free Saturday Morning, and
Right.
that was how we brought you into the fold here
Yes.
at KSJE, because who could predict we would need to do a COVID show
I know.
3 months from
I know.
when you started.
I
But
know.
here we are.
Here we
So,
are.
Anyway, so we have a great show, everybody, planned for you today. A great program to share lots of great information. We're going to be talking about vaccines with a guest from the Department of Health who is actually standing by, so we'll get to him in just a moment. We're also going to get an education update from the superintendent of schools with the
Yeah.
Central Consolidated School District on the Navajo Reservation and part of Western San Juan County. And, of course, Jeff Bourgeois, President and CEO of Salem Regional Medical Center, is also going to be calling us with an update. We talked to him actually yesterday, so we'll be giving it, but it's still a great update of how things are going at the hospital this week
Yeah, always good.
and the other stuff. So there we go. That's the plan.
Great.
So let's go to our guest, who is waiting patiently from the New Mexico Department of Health. Matt Bieber is on the phone with us this morning from the Department of Health. And Matt, good morning. Thank you for calling in this morning. We really appreciate it.
Absolutely, Scott. Thanks for the opportunity.
You bet. And we're glad to have you on because the department is really taking the lead, of course, in the rollout of the COVID vaccines. And that was really why we wanted to talk to you this morning, of course, and let us know how things are going. And so what's the latest on vaccines across our state?
Sure. Let me paint the broad picture first, and then we can dive into as much detail as you'd like. So broadly speaking, New Mexico is doing very well. We rank among the top states in terms of getting vaccine distributed to our citizens and residents most quickly. We also have something that no other state has and that an increasing number of states want, which is a statewide website that allows New Mexicans to register for vaccine. At this point, we have over 400,000 New Mexicans registered, which is something like every 1 in 5 or 6 New Mexicans. And what this system allows them to do is they go to vaccinenm.org, they enter basic health and employment information, I should say. That allows us to figure out where they go in the phases, and then it allows us to match them up with local vaccination opportunities in their communities and reach out with a text or an email, allowing them to, or enabling them to schedule an appointment.
Very good. And those are quite some unique things to our state, which, again, we're not seeing in other states. And so you mentioned the phases, and so we are now in phase 1B. Is that correct?
Exactly right. There are 4 phases, 1A, 1B, 1C, and 2. And the whole rationale for phases is that we don't have enough vaccine for everybody right this minute. If we did, we would simply offer it to everybody and get us to the goal we all seek much faster. But we have to work with the shipments we get from the federal government, and we are rolling them out to people basically in the order of how exposed are you to COVID and how vulnerable are you to COVID. And this sequence mirrors what's being done in states across the country. It mirrors the federal government CDC recommendations. But that's the goal. We want to get the vaccine to the places where it will do the most good, the most quickly, and protect the most New Mexicans.
Yeah, and I definitely commend our state for that, and I have so many questions, but let me start with this one. I know that there's been some trepidation on the parts of those who are going to get the vaccine, mostly as it pertains to, are we standing in line? Is there appointments? I mean, I know I've heard a lot of fears expressed over, if we're standing in this long line, then we're just exposing ourselves for however long. So how is that working when people show up for the vaccine?
Great question. So most vaccine providers at this point are working through the state system, and we encourage more providers to partner with us. When providers partner with the state and enroll in our website, what that allows them to do is open up a schedule calendar, kind of like you would have on Google Calendar, and create appointment slots at their location. Now, as you described, some are doing that in small groups. So Walmart might schedule 3 appointments at a time. Other providers are moving more in the mass vaccination direction. We saw UNM announce that the PIT is likely going to be used for mass vaccinations beginning next week, I believe. So the key principle here for New Mexicans to understand is that if they register through the website, they will have their choice, typically, of providers in their area, and they'll be able to decide what their own comfort levels are. Where do they want to go to get their vaccine? Do they want to go to Walmart, or do they want to go to a primary care physician or a small local pharmacy? And that's up to them.
Gotcha. That's a great point. And so the registration has been going well, and the state, I think, has been adding more options, more information to that kind of registration portal, Matt Bieber, to kind of give information about maybe pre-existing conditions or health insurance information or all those things, so the state has all these things at its disposal when enough vaccines become available for that particular individual?
Exactly right. So one piece of context to offer here is that typically, if you were going to develop a piece of software like this, you'd take a couple of years to do it, you'd put it through alpha and beta phases, you'd have the opportunity to test it every which way. We've had to do this in the space of a couple of weeks. And so given that, there are some small imperfections in the site. There are some things we're getting feedback on from New Mexicans that we can do better, and we're incorporating that feedback on a regular basis. But broadly speaking, yes, it functions exactly as you described. Users register, they give us basic employment and health information. That enables us to figure out how much exposure to COVID do they have, and in which phase should they fall in. And then it enables us to send an invitation to them at the appropriate time. So when vaccine is available in their community and they're in the current phase, they get an invitation.
Excellent. Very good.
If I may, let me say one more thing
Go ahead.
about the health info, because I know that's a reasonable concern that lots of people have. We are very conscious that the information we're asking people to provide is very sensitive information. It's HIPAA protected. The only people that will see the information that you provide in our registration website are a small number of designated state officials, typically health officials, and your vaccine provider. That's it. This information doesn't get shared with the federal government. It doesn't get shared with immigration authorities. It's just the narrow groups that I just listed, just to make sure that we can actually get you connected with a vaccine provider.
Right, and that will go into some kind of algorithm too, Matt Bieber, too, to kind of determine the person's maybe risk of COVID, depending on what their pre-existing conditions might be or other health concerns, I guess, during these different phases?
It's actually simpler than that. Basically, so if I can, let me go into a bit of detail about the phases. Phase 1A was primarily healthcare workers, as well as a couple of other high-risk categories of people like first responders and staff at congregate care facilities. Now we've moved into Phase 1B, and we're currently inviting people who are 75 plus. So it's actually pretty simple. If you are 75 plus and you're registered in the website, you should expect an invitation very soon. And the only thing limiting how quickly you get the vaccine invitation is how quickly we get vaccine into the state. And so here it's worth just sharing a bit of some numbers. In our state, we have something like 120,000 people who are 75 plus. The next subphase is people with pre-existing medical conditions, and there are approximately 500,000 of those in our state. Now, if we're getting 20 to 40,000 doses of vaccine into the state per week, you can see that it's going to take some weeks to move through the category we're in and then the following category as well. But once you've registered, you've done everything you need to do, and we'll be communicating every so often as well, just so you don't feel like you've gone into a vacuum, just letting you know that we're moving through the phase, we're making progress, and that if you haven't received an invitation yet, there's nothing to worry about. What we're doing to keep things as fair as possible is just randomizing invitations within the current subphase. So of those 120,000 75-year-olds plus the remaining 1A people who are still eligible, we're just taking those groups and randomizing the invitations so they go out to folks in as fair a way as possible.
Understood. And of course, in addition to that, you're still giving out the second doses, right, to the phase 1A people who maybe got their first dose but still need to come back in several weeks for their second dose, and that comes out of those supplies you get from the federal government as well, or are you still holding back some?
Nope, you've got it right. And what we've also done is we've built a feature into the website so that providers, when they create their scheduling calendars, they're forced essentially to set aside a portion of those appointments for second doses. Because what we don't want is folks in the situation of getting their first dose and then struggling to get an appointment for that follow-up booster dose. And so we've built a feature in to prevent that from happening.
Great. And of course, we know that there are two vaccines right now. There's Pfizer, there's Moderna. And I don't actually know I believe they were comparable. I don't know if there's updated stats on if there's one that's more effective, but to the larger point, when people are asked to, okay, now it's your turn, make an appointment, do they know up front which type they're going to receive?
It's a great question. I'd have to go double check the website. I believe the way it works is when you choose your provider location, so let's say you're in Farmington and you sign into the site, you get your invitation that tells you your vaccine's available, you can schedule at a local provider, you then go log in and look at that list of providers. I believe it indicates which type of vaccine is available at which provider so that you can make that choice, but I'd have to double check for you on that.
Great. And I have a follow-up question about the distribution because I believe both of these have to be refrigerated at like crazy low levels. And so, I mean, what is that like? And what's the shelf life there? Are we wasting quite a few vaccines when people don't show up? Or what do you do when somebody doesn't show up? Do you just immediately try to get somebody in there to, get their shot?
It's a great question. So first, to the question about cold storage, it's only Pfizer that needs to be stored at the ultra-low temperatures. And this is a factor in how we distribute because some places in the state have more capacity for ultra-low storage. The ultra-low storage only applies to the period before you thaw it. Once you bring it out of storage, both vaccines have a couple days, I think it's 5 days, I'd have to double check. I think it's approximately a 5-day window in which you can use the vaccine, which leads to your second question of what to do when you've got vaccine on hand and that expiry date is approaching. The Department of Health has developed and shared a set of requirements with all providers in the state about exactly what to do in those situations. And there are basically two situations that we are concerned about. One is the one you described where vaccine is getting close to that expiry date. The second is in which, in the current phase, a provider is having trouble filling appointments, say, for 3 days in a row. In both of those scenarios, providers are required to communicate with Department of Health, and they can do so via the website. They can specify, we have this many doses that are scheduled to expire on this date and time. Can you help? At that point, what we as Department of Health do is either work hard to push additional invitations out in the local area to make sure that more people are invited to local vaccination scheduling opportunities so we can fill up those appointments and use those doses, or we permit that provider to go out of phase and into the next group of eligible people so that vaccine doesn't get wasted. But the broad principle is exactly what you're pointing at, which is this balance between we don't want to waste a single dose of vaccine. We also don't want to invite way more people to a vaccination event than we have doses to give out. And so getting that balance right is some work, but that's what the policy is designed to achieve.
That makes sense. And so, I guess, Matt Bieber, the final kind of bottom line for folks who are watching and listening to us this morning is to make sure that they are registered, that, if they have elder members of their family who aren't already registered, again, as you mentioned, you've got folks over 75 who are in line to get the vaccine these days as part of phase 1B, but to go on that website and to get vaccinated or to get registered so they can get vaccinated if they so choose to take the vaccine. And then I think there's also a telephone hotline if folks still have questions about the registration process. Can you mention that real quick before we let you go?
Absolutely. I'm drawing up the phone number here as quickly as I can. If I don't get to it in a timely way here, I'll send it to you, and you can post it perhaps in your show notes for your viewers.
We've got it on the screen right now. I believe it's 855-600-3453.
Excellent. That's exactly right. And so when folks get to that number, they can press 0 for vaccine questions. And then if they're having difficulty or challenges or questions with the vaccination registration site, they can press 4. So 0, then 4 to get connected to support with the registration process itself. And one final note on this, we're very conscious that there are New Mexicans who don't have regular web access or they don't have cell phones, and we're working very hard to develop operational plans and communication strategies so that we're reaching out and providing registration support and support getting to vaccination appointments for populations that need that assistance. And that can be any number of people, from homebound seniors to the homeless population to people cycling in and out of prison. We're very conscious that every New Mexican needs support, and we want to help get vaccine to every New Mexican who wants it as quickly as we can.
Very good. And of course, we have also learned too that I think like the Farmington Public Library has some public computers available for folks to be able to go in and access those if they need to. Some public computers could be used for this registration process as well. But great information, Matt. We appreciate your time very much this morning. Thank you very much for calling in.
Thanks for the opportunity, and happy to do it again anytime.
Well, good. Don't lose my number. Thank you very
Thank
much.
you.
That is Matt Bieber. He is a spokesperson from the New Mexico Department of Health joining us this morning on KSJE, and we appreciate his time very much. Lots of good information.
Yeah,
the vaccines are rolling out.
Great information.
And I do think that system, that registration system, is good.
The online registration, yeah. I mean, when you compare it to what's happening in other states, I mean, it's really somewhat horrific the way that it's being rolled out in other states as far as just the disorganization of it all. So,
well, yeah.
What did you say about the 3 a.m. line?
Well, in Arizona,
they've
got a site set up 24/7, and so one of my Facebook friends was tweeting or Facebooking at 3 a.m. that they were in line, this long line of cars to get their vaccine. They're one of these kind of frontline workers.
Yeah.
And so, but that was the line. Of course, and you've got millions of people in the Phoenix area that are jonesing for that vaccine. So there you go.
Yeah, I mean, and I can definitely, obviously, speak from firsthand experience that it was very smooth. I got both doses.
Yours, right?
Yeah,
so now you're fully vaccinated.
It's complete.
There you go. And excellent. I do need to make a correction. We're at week 44. According to our calendar queen.
Yeah, thank you.
So thank you for that, keeping us on the
honest,
straight and narrow.
We have a constant fact check every Thursday.
That's right, which we appreciate.
Yeah.
And our next guest is ready to go. And good morning, you're on KSJE. Is this Daniel Benavidez?
It is. How are you doing?
I am well, sir. How are you? Daniel Benavidez, the superintendent of schools for the Central Consolidated School District. We've asked him to call in and give us kind of an update on how things are going for Central Schools. And Mr. Benavidez, before we do that, I have to have you explain the picture we're going to show of you on a mountaintop somewhere. It's off of your website.
Yeah, I've been real stingy with my photo over the years, just because of social media and stuff like that. And I thought when my sons took the picture of me up on the Santa Fe ski basin. It was either that or a hunting picture, and I thought, well, this one looks a little bit better than me killing an elk or something like that. So
there you go. Well, that explains it. So perfect. So classes have resumed for Central Schools after the winter break, and so can you give us kind of an idea of how things are going? You're still teachers are still meeting with their students remotely. Is that still the case?
That's correct, Scott. We're all remote. We're waiting for this afternoon's press conference from the governor to see if restrictions are lifted. And while I was waiting for you, every Thursday we have a call with Secretary of Ed, Ryan Stewart, and briefly, you guys, good timing. I guess it's better be lucky than good, because he was mentioning there is a possibility. I say possibility because I don't know when they were kind of teasing us, but there is a possibility that kids can come back 6 through 12 in the hybrid model, but they haven't given us a date or a time frame or anything like that. But they teased us with that, and that's the closest thing we've heard to having 6 through 12 back in the hybrid model since March. So
I was going to say that's significant.
Yeah, it is. So we'll see what happens this afternoon. Maybe the secretary was teasing us today in the call, and then we'll get better news this afternoon. Fingers crossed.
Indeed. I know there's a lot of parents who are hopeful for that. And of course, in addition to the other grade levels that have had some success in going back into school and then having to go back into remote learning. So that's good news. We'll stay tuned and find out what they say about that.
Yeah. Hi, this is Megan, by the way.
How you doing?
Good. I also appreciate the headshot. I love the beanie most of all. So it makes it look like you have like a bunch of hair under there. But I want to ask a question. Go on.
No, I was just going to say that I did at the time, then I got it cut. So, yeah, it does hide stuff.
There you go.
I love it. I have a question about technology. Obviously, every school district is different, and I know, like, Farmington schools have always issued personal laptops and whatevers, and we know that, especially in your district, there's some problems accessing the internet, which is a whole nother wrench thrown into this whole thing. So what have we been doing out there to address these technological access issues?
So good question. Appreciate it. All our kids, kindergarten through second grade and grades 9 through 12, all have, they're at the sites. They've been passing them out prior to break, and they're still passing them out. 9 through 12 are getting all brand new MacBooks, and then the grades kindergarten through second grade will be getting brand new iPads, and that's based on site delivery, so each site will be giving them out to their students. 3 through 8, there's a back order for Chromebooks, so what we've done is we're taking all the excess or older models of laptops that we had in the district and redistributing to them, and that should help us get through until the new Chromebooks come in. And so we foresee, hopefully in August, if everything goes right, that we will have, all our students will have a device to take home or use at school, which is really cool. It's never happened in this district like this before, especially with new technology. And then the bandwidth, we're still having issues with conductivity. And so what we've done is we spent a little bit of money out of our outside of our E-rate money, and we've increased the bandwidth to all our sites. So the district was getting roughly plus or minus 1.9 gigabytes for the entire district, all the way to Newcomb, Shiprock, and Kirtland Central. We were sharing 1.9, and now we've increased the bandwidth to 10 gigabytes for the entire district. So that should help with Wi-Fi connections outside if people need to park and do those kinds of things. But conductivity is probably the hugest issue and thing that I think about on a daily basis, just because I think we can move faster. And we're hoping with Navajo Nation, because we're on tribal land, some of our districts on tribal land, that they help us out with that. So that's where we're at.
Gotcha. And so that was my other question for you, Superintendent Benavides, is that, with this new technology going out to your students, which is excellent, and as you mentioned, the first time ever in Central School's history that you're able to do this for your students, if they can't connect, then they just have a new computer to do their homework on, but they really can't submit it. And so what you're saying is maybe offering some hotspots in parking lots outside of schools or chapter houses that I guess your students could go in and sit in a car and be able to at least upload assignments and download new assignments and at least connect that way, even kind of temporarily?
Yeah, Scott, you hit on it right there. Even though they may not have conductivity at their house, or at a chapter house or it's limited, the idea is that they can go to a site, upload and download their assignments, and then take it home. Then the only problem becomes that if they don't have electricity on their site, then at their house, then they'll only be able to use it for a few hours. But the new MacBooks are really cool because they have 8 hours of battery, so there's a good chance that they can use that and then go recharge somewhere. We've talked about expanding the distribution of individual solar panels, kind of like what you use or I use when I go hiking or hunting. You're able to charge your devices with a really small panel and use the sun for that, and doesn't cost anything. So we'll look to expand that if necessary. But again, the devices are really cool. We're just hoping that people understand that we're trying our best to do what we can for them. I hate the Band-Aid solution with hotspots and that kind of stuff. So again, the increased bandwidth for our Wi-Fi to shoot further out so more people can access those is a start.
Very good. And we have one last question for you before we let you go, and that is the case of these students that go MIA. When you're not seeing students every day, it's hard to know what's going on in their lives. And, we know that some students have just kind of disappeared. So are you guys able to reach out to those? Like, what's that effort like?
So we've spent a lot of time with our counselors and our teachers and, quite frankly, our site staff looking for these individuals. I wouldn't say that they've disappeared in thin air. I think that parents have done a really good job, and I don't mean that in a bad way, but they've sheltered their kids and they're not letting their kids out. And so, accessibility to them is hard, so they've kept them at home and they're not being accounted for. There are a lot of kids that are homeschooled that never registered with us that we're finding out, which we actually get credit. So we encourage, if you do decide, which I would hope that you would trust all districts, whether it's Farmington, Central, Bloomfield, or Aztec. If you're homeschooled, register at your local school district. That way we can still get credit for those students and provide some services to you guys or to those students. But if you don't register them, we can't provide services for them even though they're homeschooled. So we encourage that. But to answer your question, it's hard. Parents are rightfully cautious to keep their kids at home and then not let them out. So, but we've tried our best to reach out to them, phone, email, walking to their houses very strategically, keeping our distance, knocking on doors, and we've dwindled that number down. I don't have the latest figures, but we've dwindled it down. So.
Very good. Well, Daniel Benavides, thank you so much for joining us this morning. It's great to hear an update from you.
Well, thank you very much. You guys be safe, and it was good talking to both of you.
You too, Superintendent Benavides. Thank you, and good luck on the ski slopes if you head out there. So stay safe.
We need some snow first.
Yeah,
We do.
That's true.
That's true. Very true. Well, thank you very much, Sir Daniel Benavides. We appreciate that very much. And there you go, our guest here on KSJE. And more comments for the calendar queen, which we have to post because we appreciate all of her efforts.
Let's hear it for the calendar queen.
Yeah,
that's what we have.
She's getting quite the reputation, I guess. On
she should, and I know that every week she's like, all you have to do is use a calendar.
I know, you too.
But
That's
you've enabled us, so
yeah, we know
Vicki
that she's going to be
us.
there to correct us. So there you go. So anyway, we have one more guest, but in the meantime, we do want to kind of talk about our other kind of information that we like to pass along, including the upcoming testing numbers, which I would have to remove our posts to be able to see that. So let me do that.
Well, we have a testing date for tomorrow, Friday,
Yes.
January 15th at McGee Park, 9 a.m. to 10:30 a.m. Always remember you have to pre-register for this, and this is how they're getting so efficient at this. Go to cvtestreg.nmhealth.org.
Right, to register.
And be prepared to present your confirmation. They send you a confirmation number, so make sure you have that.
when you go.
Yeah.
For your test.
Yep.
So and that's testing. So that's what's going on. Of course, the tests are still going on at the Judy Nelson Elementary School in Kirtland as well. Those are the other type of tests, the different type of test, right? And that's still going on every day, 10 to 3. And so we always like to share that information as well to let you know that is still available. And the tests have been kind of Monday, Wednesday, Friday at McGee Park. And so I assume that that's going to be the schedule again probably next week, but we haven't seen it officially yet. So that's why we only share the Friday info with everybody and this one. So there you go. The latest Johns Hopkins numbers are here. And so where are we looking this week?
Gosh, well, as always, we're looking sad. So we have 23,079,163 cases confirmed in the United States. And the death toll in the United States now stands at 384,794 deaths. And I think we discussed the other day that this is like 4,000 deaths per day.
That's what we're seeing. Yeah,
something very high,
right,
like that. Yeah.
Yeah, and we've hit another record numbers of daily fatalities just since last week's show.
Right.
We're still seeing that. So
there's something called. Have you heard of this concept of magical thinking, Scott?
I have not.
Okay. So this concept, this is an example of this that, so now we're 10 months in, and there's some magical thinking going
44
on.
weeks.
44 weeks to be exact. There's some magical thinking going on in regards to, well, I haven't gotten it in 10 months, so it's probably fine. I'm not going to get it, right? As time goes on, there's this level of like, well, I must be immune to this.
Right, or something, right.
Yeah.
Okay.
And so I think that there's a bit of that happening as this drags on, and it gets, everybody's exhausted, everybody's just sick of it, and so I think that there might be some of that where we start losing our vigilance because we have yet to be impacted, maybe
letting our guard down
so,
after all this time. I see that. That does make
we
sense.
call this magical thinking.
Okay, well, we don't that's not good.
We don't know. Magical thinking is never good.
Yeah,
in my opinion.
Okay. Gotcha.
Yep.
Some of the other numbers we want to share with you as well across our state. Again, the numbers from yesterday that were released, another 1,496 new cases in New Mexico. For a total now, we're just under 150,000 cases since March. In San Juan County, there were another 154 cases yesterday. We had been down to the double digits, like the high double digits, but this is, again, not the case. But earlier in the week, they were maybe lower numbers. We're now at 10,877 total cases in San Juan County. 47 additional deaths in New Mexico. Two of those, were in San Juan County. And now the recoveries are at 72,089, another 1,352 recoveries. So there's that number as well, which I'd like to share because that's significant.
Yes.
As well. And then the other news stories, of course, on KSJE.com. We update this every day. We've been doing that for the last 44 weeks. The latest daily numbers from the state, from the Navajo Nation. And again, their active cases are now at 25,746. They had another 169 reported on Wednesday, and another 5 deaths reported on Wednesday for a total now of 879. And the other significant news story that we want to pass along is that the Navajo Nation has extended that stay-at-home order until January 25th. That means the weekend curfews are extended and all those other things too, and the different operating hours for retail on the reservation.
The curfew over the weekend is from 8 p.m. through 5 a.m. every night. So exactly.
So there's that. The 57-hour weekend lockdowns are what we're talking about. So that is happening as well. And then again, the essential businesses can only operate from 7 a.m. to 7 p.m. Monday through Friday only.
Yep.
So there's that on the reservation as well. The map that was updated, as if you recall, last week, Catron County was in the yellow. They're now back into the red. That's the county kind of due south of us here. But we have 2 other counties that are not in the red, and so they're worth mentioning. And they're not San Juan, unfortunately. We are still in the red here.
Right.
But and I need to look at my New Mexico map because those counties escape me.
Well, okay, so we're in the northeast.
Mm-hmm. So we have one county in the yellow and one county in the green. And so,
which looks somewhat teal on our screen.
Yes, it
for
does.
some reason.
So, so the yellow county is Union County, home of Clayton, New Mexico, and not very many people in Union County.
I would not
and
suspect.
the green county is, I think, even smaller, and that's Harding County, and so they are now in the green zone and part of the reopening. So
Good.
there you go. And the other ones aren't going. As we look at San Juan County, I believe our positivity rate has come down just a bit. If you recall, last week we were around 19-20%.
Yep.
And this week it's 18.9. So we'll take
Okay,
it, even
we'll
though
take
it's
it.
fractional.
We'll take it,
We'll
yeah.
take it.
Perhaps statistically insignificant, but still,
Yeah.
we'll take it.
It's going in the right direction.
Yes.
I guess is why I wanted
0.9%,
to
man.
share that. Yes. And then the watch list is the other thing that we'd like to pass along. And of course, there are several places that have had rapid responses. These are the number of rapid responses, not the number of cases that have been reported. And so we've got Roots Home Health Care on San Juan Boulevard in Farmington with 2, Southwestern Private Services on Highway 491 in Shiprock, 2, Citizens Bank in Aztec with 2, Safeway in Aztec with 4, Albertsons in Farmington with 4, Alsco in Farmington with 3, Safeway East Main with 3, Safeway West Main in Farmington with 2, and the maintenance on West Aztec Boulevard with 2 in Aztec. But none of these have been closed down. There are no closures locally because of any of these rapid responses. And again, the state kind of changed that policy.
Right.
However, there are closures around the state. There are other businesses and other communities that have been shut down, but none here in San Juan County. So there's no closures to display.
Right.
So that's where we are with that. And as I take one more look to see, I think that's all we had to share with everybody.
Yes.
So shall we talk to Jeff Bourgeois?
Yes.
And explain why you're going to be sent out of the studio back to some undesignated location.
That's right.
Okay. Here we go. Joining us this morning to give us an update on conditions at San Juan Regional Medical Center, Jeff Bourgeois is standing by from the hospital. Mr. Bourgeois, good morning. Happy New Year.
Good morning, Scott and Megan. Happy New Year to the both of you.
Thank you very much. And let us know how things are faring here at the hospital this week. What are the latest numbers that you can share with us this morning?
Okay. Well, these numbers that I'm sharing are as of Wednesday morning, January 13th. We continue to see a very high census, a total of 177 patients in-house as of this Wednesday morning. 79 of those are positive COVID patients. We have another 17 that are under investigation pending test results, and a few other respiratory type diagnoses for a total respiratory floor census of 89. So very, very busy hospital. We have also noticed that the acuity of illness of our patients is really at an all-time high, and that is consistent with what other hospitals in the state are reporting now, both for COVID and non-COVID related diagnoses. So it's a very, very busy time in terms of just overall number of inpatients as well as the acuity of their illness that we're seeing. What I can tell you also is that on our positivity rate, as I look at our 14 and 7-day rolling average of positivity for results for tests taken at the hospital, again, this is not countywide numbers, just those tests that we are responsible for completing. It's still very high. The 7-day rate has dropped down to about 20%, and I say dropped down to 20%. 20% is still awfully high against the state's target of 5%. And our 14-day rate is still right around 25%. So still a high level of disease presence in our community, particularly among the patients that we're seeing, obviously. On the vaccination front, I'm happy to report that we have about a total of 50% of our employees fully vaccinated now, and we've continued to work with other other agencies and healthcare providers to provide vaccinations to them. So sheriff's departments, state police, local police department, fire department, physicians and physician office personnel, and also essential workers who are unable to work from home. We've been vaccinating all of those different agencies and those types of employees. If you have a listener that believes they are an essential worker who is unable to work from home and would like to get a vaccine, they are to go through their supervisors to coordinate a schedule with us at the hospital, and the supervisors and our team will make sure that they have the proper consents available. Community-wide vaccinations are going to be handled here locally through a collaborative effort of the county and the Department of Health. We will, at San Juan Regional, of course, cooperate in however we are asked to do so, but they are taking the lead in coordinating our community-wide vaccine approach. So in the meantime, I would encourage all your listeners who are interested in receiving the vaccine to go ahead and get registered. And if they could do that by going to vaccinenm.org, that will take you to the state's vaccine registration site to go ahead and get your information recorded and get people in the queue for vaccinations when they do become available. And then one other question that we're starting to see is that from people who've received their second dose of vaccination, do they need to quarantine after travel or after suspected exposure to a positive individual? And current CDC recommendations have not changed in the post-vaccine environment as of yet. And so what that means is, yes, we still recommend following CDC guidelines and quarantining after travel or after suspected exposure, even if you've been fully vaccinated. That may change as more data becomes available, but I think CDC is taking an evidence-based and a cautious approach to changing the recommendations if they do so. So right now, as I said, their recommendations are to continue the practice of quarantining after travel or possible exposure. And of course, along with that goes all the other social distancing, masking, washing hands, etc. Recommendations that have been in place for so long now.
Very good. Thank you. Megan, you have a question?
Yes, just I have a couple of questions, and the first one is just you had mentioned sort of a more healthcare technical term back when you were reporting about patients in the hospital, and you mentioned the rate of acuity being higher. So for listeners who are more unfamiliar with the lingo there, what does that mean?
Okay, that means how sick they are, the critical nature of their specific condition that causes them to be in the hospital. So the sicker they are, we would say the higher their acuity is.
Right, gotcha. And the follow-up is in regards to the vaccine with 50% of employees being vaccinated. Have they gotten the complete round? We know that these are two vaccines are needed to complete that round. Have they gotten their second one yet?
Many have, and some haven't. And it's due to the schedule of when they got their first one. So, for example, tonight I am scheduled to receive my second dose. Again, this being Wednesday, and we have others coming online now to get their first dose.
Got it. Very good. And Megan, you have a follow-up?
I do. Well, it's actually a slight change in direction, but I believe at one point we might have talked about having to double up rooms. We already talked about how we've had to convert certain floors to COVID floors. Are we putting 2 patients per room now? I mean, one of the great things about San Juan Regional was that there was always, people at their individual rooms, and that's actually outstanding compared to a lot of hospitals in the nation. But given the rate of hospitalizations, are we putting 2 per room, or how's that looking?
We have done that, Megan, but really on very limited circumstances. And most of that has been when there are members of the same family hospitalized, that we've been able to allow them to share rooms. That's actually oftentimes viewed favorably.
Sure. Interesting.
But we have had those occasions just due to number of beds available that we have had to go to semi-privates on it's the exception rather than the rule, I would say, just because of how our patient rooms are structured.
Right, that makes sense, Jeff Bourgeois. But I guess it certainly gives you a little bit of expansion room if you need it to house additional patients, even if they're within the same family. I wanted to ask you a little bit about the numbers. You said that numbers are still high. They're at the hospital, of course. We have seen, at least in recent days, some of the numbers coming down just a bit. Are those numbers that you're watching to maybe predict what your numbers are going to be maybe a week from now or in the next couple of weeks? Are you kind of watching those state numbers that are reported every day?
We are every day. The hospitalization statewide is still over 700, and that's off from the peak, but it's not dropping precipitously. In fact, today there's just a few more than there was yesterday, about a dozen or so. So it's there's typically a 2 to 14 day, there's a wide range, a 2 to 14 day incubation period from when you're exposed to when you might begin showing symptoms. And then there's if someone is going to get sick enough to be hospitalized, there could be even more time. So, being that this is only the 13th of January, if there was going to be a spike from holiday related, specifically Christmas and New Year's gatherings, we could still see some increase from those here in the next 2 weeks, I would estimate.
Sure.
We haven't seen a softening of our census really as of yet. This is still a very, very busy time.
Right. Understood. And one final question from me, at least, Jeff Bourgeois, before we let you go this morning, and that is back to the vaccines. We have heard other states may be struggling with getting the vaccines kind of into the arms of those that need them. You mentioned 50% of your staff has now had the vaccine, some having the second dose. And also, can you give us an idea as a healthcare professional kind of how our state is faring compared to others? It seems like the rollout has been fairly smooth, and as long as the doses keep coming in, the state seems to have a system in place to get them into the arms of these frontline workers, these nursing home residents, these caregivers, and the others according to that phased plan that we've been seeing. We're now in phase 1B, I think, of the vaccination rollout, correct? Are we doing, I guess my short question is, how are we doing?
Yeah, I think the state of New Mexico in general is doing very well. This is a big project, as you can imagine, to logistically coordinate. I heard a report earlier today that in Albuquerque, there's going to be vaccinations being delivered at the University of New Mexico basketball arena, the pit. And so, there's every community is going to be a little different in the logistically on the locations that they have available to provide the vaccines. And as I mentioned, we're going to collaborate with the Department of Health in our county here locally in whatever way they ask us to assist in the more widespread vaccination to our general community once that is available.
Great. And I have one final question for you, because I always like to get an update as it pertains to elective surgeries and other routine health screenings, x-rays, routine procedures, etc. What is the update on how those are going. Are we doing elective surgeries again? Are we putting them on hold for a bit?
As far as, let's take the second part of that question first, if I could, Megan. So routine health screenings and diagnostic testing and things that your physician would recommend, we strongly encourage that you do not delay those. We believe that a delay in that type of work over the past year it's what's leading to the higher acuity in hospitals across the state right now. So if your physician feels you need any type of diagnostic workup, we strongly encourage you to follow their recommendations. And with respect to surgeries, I believe I've been out of pocket for a little bit here, but I believe the state had a public health order that expired January 4th and has now been extended. I need to confirm that, but I believe that still limits elective surgeries. So we still have a team of surgeons and anesthesiologists that meet every day to review our surgery schedule to make sure that those cases are necessary. The motive behind that, as you can well imagine, is to make sure that we keep every bed available for the COVID patients that are continuing to present to our hospital.
That makes sense. Jeff Bourgeois, it kind of also goes in, I think, with what Dr. Underwood told us recently, too, was that maybe if a surgery could be done and the patient doesn't have to stay overnight at the hospital, they could go home to recover, that maybe some of those were still able to be performed.
Yeah, they are, and that's, again, reviewed on a case-by-case basis. So, I think the team of surgeons and doctors that we have looking at that are doing great work to make sure patients who need surgery are getting it, and also conserve our hospital beds as much as possible.
Sure, of course. Well, Jeff Bourgeois, again, we always appreciate speaking with you to get an update on the conditions at the hospital and also to allow us to pass through you our sincere thanks to all the folks working on the front lines there at San Juan Regional Medical Center to keep us all safe and well. Thank you for joining us this morning.
My pleasure. Thank you both, Scott and Megan. Have a great day.
All right.
Thank you. You too.
You're very welcome. That is Jeff Bourgeois, the President and CEO of San Juan Regional Medical Center, our guest this morning. And we're back here in the studio, everybody. So thank you, Jeff Bourgeois, again. Thank you, Megan, for that, from your undisclosed location.
Oh, my God. I was commenting.
You didn't you were too close to the camera, you thought?
The entire time, I'm like, why
big?
is my face so large? Yeah, it just didn't.
It's webcam.
It didn't seem like that. You know, you're looking at your face on the screen, you're like, okay, well, yeah, I look pretty good. And then I was like,
no, you're mortified. I'm sorry.
I'm so mortified.
Poor thing. Anyways, that's our show.
That is our show.
That's our show. Before we go, you've got a show on Saturday, a music show. If folks are looking for something different to listen to, they can join the Megan Cullum fan club.
Yeah, Radio Free Saturday Morning is every Saturday morning, 9 to 11 a.m., Mountain Time, of course, and you can listen from anywhere that you have an internet connection, you can stream.
Yeah.
If you want to use your actual radio, which that's how I roll, it's 90.9 FM, of course, and then 103.3 FM in Durango, and each week I tend to organize it around.
I know we like you have a staff.
I know.
Come
I don't
on.
know why I do that.
I don't know. But anyway, you.
I'm always speaking in we.
Okay.
I need to stop doing that.
The royal we.
Yeah, I know, right?
It.
Like as though everybody's behind me.
There's only one room for one queen. It's a calendar queen. So I'm sorry. That's the royal
I've always
we.
wanted to be prime minister anyway.
Okay.
Anyway,
this week you're doing what?
Yeah, so for the month of January we're doing Best of 2020. So we're highlighting all of the music that dropped in the year of 2020 and picking out some of the more critically acclaimed as well as my personal favorites. And so we have what is this, like 3 more weeks of that this week and then 2 more because January's long. Something like that.
Maybe.
Calendar Queen. Paging Calendar
There are
Queen.
3 more Saturdays, including this Saturday.
Including this one. So we'll do
January,
it again this one and then 2 more. So because, of course, there's enough that came out.
Yeah.
It's like I've been saying is the cool thing is that we have a lot of cuts that artists have done during quarantine. So it's not, so for example, I played the Toronto Symphony doing Appalachian Spring, that one that was early on, where they're recording from each of their homes, and
Right.
so there's some touching stuff on there too. But in general, people get resourceful and creative, and that's kind of the role of the artist, is to make some good some beautiful commentary on whatever's going on in the world. So
True, and you celebrate that on your show.
I do.
That's
So
great.
anyway, so tune in 9 to 11 a.m.
Saturday mornings, everybody.
Radio
And again, on everything you can think of: radio, internet, smart
speaker. You can just say
right?
play KSJE, and
Alexa will do it, and maybe Google Home too.
yeah,
You're everywhere.
household name.
Okay.
You can even get a T-shirt.
There are radio-free Saturday morning T-shirts, everybody. How about that?
How about that?
And help support KSJE.
Exactly. It's a dream come true. I know that I was asking you for that for a long time. And
There's a logo. There's an actual logo.
There's a logo.
And everything. So KSJE.com/support. You
Yeah.
can check it out. So, all right, we're going
Cool.
to go. Thank you, everybody. Thanks for joining us. And we will see you back here next Thursday for our COVID-19 community information program. Stay well and stay safe.